Good evening, everyone. My name is Joanna Major, and I serve as the Secretary of Institution Malaysia. I warmly welcome all of you professors, doctors, nurses, dietitians, all healthcare professionals, medical students, and of course our esteemed guest, Dr. Ngo, for joining us on this Sunday night for our institution webinar, an introduction to bariatric surgery and essential nutritional management. We are honored to have Dr. Ngo host Jungwon as our guest speaker tonight. We will appreciate if all the participants could use the visual background we provide for this event, which you could find out then in the email together with the Zoom link provided. First, let us welcome our President of Institution Malaysia, Dr. Lin Yee-Siew, to deliver the opening speech.
Thank you, Joanna, and good evening, everyone. I'm honored to welcome all of you to this insightful webinar, and happy Father's Day to those who are celebrating. First and foremost, I would like to extend my heartfelt gratitude to our esteemed speaker, Dr. Ngo Chun-won. Dr. Ngo, thank you for sharing your expertise with us today and for your generous sponsorship for the quizzes sessions. Your support and contribution to this event are invaluable. I would also like to express our sincere appreciation to our sponsor, Hugh, for their unwavering support, and also a special thank you to Jane Chiu, Hugh's representative, and also the founder, for sponsoring 5 copies of the ebook Fat to Fit, Not a Fat, co-written by Jane herself, a dietitian, Meg Yesit, and also our honorable speaker, Dr. Ngo. And we are incredibly fortunate to have such dedicated and supportive partners, and your contribution have significantly enhanced the value of this webinar. To all participants, thank you for joining us tonight, especially on the Sunday night and on a Father's Day celebration. Your presence and engagement are what make these events meaningful and successful, and I hope you'll find today's sessions enriching and informative. I would also like to acknowledge and thank Joanna for being instrumental in connecting us with Dr. Ngo. Last but not least, a big thank you to all committee members who have worked tirelessly behind the scenes to ensure smooth running of this webinar. Your hard work and dedication do not go unnoticed, and I am truly grateful for your support. Thank you so much, and back to you, Joanna.
Thank you so much, Dr. Lin Yee-Siew. On behalf of Institution Malaysia, we would like to express our gratitude to our sponsorship partner, Hugh Club. We are pleased to invite Ms. Jen Chiu, founder of Hugh, to tell us more about Hugh's. And Ms. Jen, you have the floor.
Hello, everyone. Thank you for having me here and the opportunity to speak to so many doctors and maybe some other wellness professionals here as well. Yeah, so I'm the founder of Hugh Club, and together with Dr. Ngo and the other another dietitian, we actually wrote the book called Fat to Fit. So through Hugh Club, our objective is really to educate the public to actually practice healthy lifestyle so that they can actually prevent metabolic syndrome such as diabetes and other diseases later part of their life. So what the HEAL actually stands for, four elements. So for example, H actually stands for the most important thing. It stands for habit and mindset. So because asking people to change is not easy. So in our program, we actually try to, we emphasize a lot on habit forming and mindset change. Yeah, that's the thing. So other alphabets that you can see from here, like for example, E actually stands for exercise and hydration. A actually stands for very basic thing, means adequate sleep. And L actually stands for our diet approach, which is low carb, high protein. So we are using science-based methodology to help our clients to reverse health. Yeah, so that is about health. Hugh Club. So I pass the floor back to Joanna. Thank you. Oh, okay. Thank you for featuring our YouTube channel as well. So if you have a chance, just hit to the Fabulous Body Mind to like the channel. And thank you for your support. Thank you.
Yeah, maybe I will let our participants to have a few seconds of time to scan the QR code. that hey, this will be a promising YouTube channel that you won't want to miss in order to seek for a better healthcare as well as more information awaiting for you. Thank you, Miss Jen. And now maybe we can take a group photograph together. So participant, we will welcome you to open your camera and let's have a group picture together. Thank you. Jensen, can you help to take the picture?
Hi, sure. So, dear participant, please turn on your camera if you are comfortable with turning on, and please use our virtual background as well. So wait for a while for participants to turn on their camera. Yeah? So you will now be taking the picture. So show us your brightest smile in 3, 2, 1. Maintaining. I'll take for 2 page. Right? Maintaining. All right. 3, 2, 1. All right. Thank you very much.
All right. I would also like to introduce the ebooks that co-written by our Hill founder, Jen Chiu, dietitians, music, and also our honored speaker, Dr. Ngo. So if you are interested in knowing more, feel free to scan the QR code as well, the ebook link. All right, thank you. So now I would like to privilege to invite our esteemed guest speaker. So now is my privilege to invite our esteemed guest speaker, Dr. Ngo Chun, to share his insight with us. Before that, allow me to introduce Dr. Ngo. He is a distinguished surgeon specializing in bariatric and upper gastrointestinal surgery, renowned for his expertise in minimally invasive and robotic techniques. He has completed prestigious fellowships at China Medical University and Changgung Memorial Hospital in Taiwan. As the former head of the General Surgical Department at Hospital Angel Besar Hajia Kaohsiung in Guam, he pioneered initiatives like the nutrition therapy team, significantly enhancing patients' care. Dr. Ngo also chairs the Malaysian's Upper Gastrointestinal Surgery MUGIS Society Cancer Database Committee. He has served as a clinical lecturer at Monash University, Malaysia, International Medical University, and Newcastle Medical University. His commitment to advancing his knowledge and skills has taken him across Malaysia, earning his numerous accolades, including the awards for excellence in service from the health departments of Terengganu and Sabah. Driven by patients to eliminate obesity, Dr. Ngo continues to contribute to the medical field with unwavering dedication. Now, I would like to invite Dr. Ngo for his presentation. Thank you.
Sorry, I couldn't share my screen. Hold on. Hello. Can you guys hear me?
Yep, audible,
Okay.
and we can
Yeah.
see your screen. Thank you.
Okay. Thanks. Uh, so sorry for the small hiccup. Okay. If you know that actually I have been left this Zoom platform for quite a while, so I have to find where are the buttons. So thank you, Joanna, and for the kind introduction. And we make it is like sounds very serious today. So I would like to be interactive a bit. All right. You know there's a chat room there, right? Can you please put what you are is like as if as in you are medical students, you are nurses, you are physical coach, or you are any other occupation, just write in the chat group. Uh, so I will know roughly the demography of this audience today. Yeah. Remember to send to the meeting group chat. Don't send directly to anybody else. Let's start the ball rolling. Oh, somebody put in already. Yeah, Issue is a medical graduate from IMU. Yeah. Medical student. Oh, okay. Most of these medical students. Oh, from UPN. Okay, my alma mater, UPN. All right. Okay. IMU. Right. Well, I guess most of those are medical students here, right? All right. So this actually I do not think this in the syllabus, right? I don't think it's in the syllabus. But it's good to know, and it's actually one of my niche for metabolic and bariatric surgery. Then, oh yeah, so I couldn't wish you all happy Father's Day, right? But maybe some of you uh, illegitimate father also happy Father's Day lah. Okay, just joking. Oh, still medical student coming in. All right. So about this metabolic and bariatric surgery. Um, Now I just going to start the service. It's not only in bariatric but also upper GI. But the thing is, my niche is actually metabolic and bariatric surgery, or we call it MBS, right? So this is my hospital. I'm going to go here in July 1st. So Enche Besar Haja Kaosong is in Kluang. For those of you who don't know where is Kluang, it's actually central Johor. So this is the hospital. It's very small hospital, but I love it. All right, small is good. All right. Disclaimer: I am actually affiliated to Heal Program, right? So I'm affiliated to Jane. Uh, this I think I met with Joanna. All right, met with Joanna in Taiwan, and she actually kind enough to invite me as a guest speaker today and to speak to you guys about this topic. So feel free to ask any question. You can just type in the chat box, right? And there is also, I think there's a Q&A thingy there. You can just put it there, then we will see it. All right. So, but one thing is this is a cut out of a newspaper. This is from Straits Time, and this is not something very old. It's quite new. It's in last month, May 16th, right? So half a million is 500K, 500K Malaysian adults have diabetes, hypertension, cholesterol, and plus with the obesity. So what does it mean? This is actually a metabolic syndrome, right? So what it meant is that is more than half a million. It might be 99,999,999, right? Of Malaysia. It can say like that, right? But if you look at the Malaysian population, since 2021, it's 33 million, right? 33 million, and this more than 500,000 of adults, it seems like a small number, but if you compare to 33 million, right? But one thing is, you must understand this bariatric, metabolic and bariatric surgery is nothing but all about metabolic syndrome and also morbid obesity, right? Okay, so this is something very, very specific, and that's why I think this is it's not in your syllabus, and because it is so specific, even some of the general surgeon also we sometimes we get confused as well. But today you guys are going to be the experts, right? Are going to be expert in all these metabolic and bariatric surgery lah, hopefully. All right, for this purely me how to rant and rant because this is medical students, the audience is medical students, so I go very, very fundamental. All right, so body mass index, if Joanna actually knows me, I hate a BMI. Okay, I'll tell you why. Okay, BMI is body mass index because it's very not accurate. It's not accurate at all. But this is one of the criteria for us to know if the patient is a morbid obesity or not. So you use weight in kilogram, all right? Don't use ounce, okay? Okay. And then height in meters, but height is a square, okay? Kuasa dua lah, we are Malaysian here, right? Okay, so height in square. So they you get the index, which is a BMI, right? So, okay, host, maybe you can just mute. Okay, thanks. Now, one thing is a BMI based weight classification for adults. This is for more than 18 years of age. Why 18 years of age? Because pediatric population, adolescents, BMI is another topic, right, for bariatric and metabolic. And then this underweight, you see the index for Asian country, right? Malaysian is inside Asia, right? Okay, so we are also Asian country, right? So we do not use the American standards. We do not use the international standard in which if you say it's a obese class 1 is 30, but we have to reduce 2.5. So if you later you guys check, all right, okay, then I can assure you, all right, two out of one, you guys are actually here at least pre-obese. All right, later I show you the statistics. All right, so that's why this is something very interesting and actually it's quite concerning. It's quite concerning in Malaysia, right? That's why this is one of the thing, one of the concern, and I would like to venture myself into to help to make Malaysian healthier, right? So if you look at this, pre-obese is 23. If you are BMI 23, you are already pre-obese, right? And if you look at obese class 2, obese class 2 is actually, or what we doubt as morbid obesity. All right, morbid obesity is actually 32.5 and above, right? And what if the BMI is more than 40? What do you call that? Anybody knows that? Anybody knows that? What if more than 40? You see, this is obesity class 3, 37.5. What if it's more than 40? Morbidly obesity, another LY, very good try, okay? We call it super obese, all right? Okay, so we have super obese, we have super obese, now we have mega obese. I don't know later on we giga obese or not. I tell you, that is the problem with the weight. Okay, that is actually called a set point theory. There's a set point theory is that for a human being, they would like to increase their weight. Like they would like to increase their weight as high as possible. There is no stop. Right. So the only thing that can reverse it right? If you are already a morbid obesity, which is a 32.5, right? Actually, metabolic and bariatric surgery is the way to go. Okay, so this is actually very freshly baked statistic. I think this is only came out last month. The statistic is the 2023, and if you look at that, 2023, our obesity, this is actually BMI 25. Why use 25? Because internationally, we define overweight as 25, but not in Malaysia, we have 2023. But this one, we can roughly know the statistic of obesity, which is 54.4%. What does it mean by 54.4%? All right. If you guys now is Zoomer, it's very difficult to say. Okay, now you have how many of us here? We have 36. Nice, 36 participants here. That means 33 of us is already BMI 25. That is what statistics is all about. So this is actually very concerning. If you look beside your friend is actually is either your friend is obesity or you are obese. Okay, so that is what 54.4% means. So why obesity is very important is because the complication of the morbid obesity, the complication is start from head to toe. This is actually a known fact. We have known this for decades. But why we don't do anything about it? Yeah, that is the question, right? That is a million dollar question. All right. So if you the most important is the cardiac, the renal, the gastrointestinal, which is the fatty liver. It can also cause liver cirrhosis in the end, and it can cause pulmonary, right? So all in all, you can divide this into metabolic complication, all right, or mechanical complication. Mechanical complication in which is the musculoskeletal, which is your osteoarthritis. It can back pain. It can present with back pain. It can even present with spondylosis. So that's why obesity is something that will kill Malaysians, right? So, but just now I said I hate BMI. Why I hate BMI? Because BMI doesn't tell you how obese is obese. How obese you are obese. So how to track obesity? So today I like to introduce you this thing. It's called body impedance analysis of BIA. So the problem with BIA, this BIA is actually quite long already. I think since 1980s, the 1920s, sorry, 1920s. But the one thing is, why is it not so popular? Imagine my ward, if you guys in my ward, okay, my previous hospital ward, right? The patients are weightless. Most of our patients are weightless. So why our patients are weightless? Because the nurses are burnt out. The nurses are burnt out. The patients are not being weighed. So that is the problem. If you want to get BMI, it's a problem. What more you want to get the BIA? But one thing is, if you really wanted to treat obesity and metabolic syndrome, you must always get the BIA. BIA is not any other weighing scale. It's a special scale. The cheapest one I think is 30K RM lah. Right? So what is the advantage of this BIA machine? You can know the hydration. You would know the most important is the fat-free mass, right? That which is the muscle mass. Then you have your fat mass. You have skeletal muscle mass. Or this is actually very specific. Skeletal muscle mass and fat-free mass, right? So it will come out with something like this, a report like that, right? As what Joanna told you guys, I was in a China Medical, right? In China Medical, there is an obesity medical center. So they only do bariatric and metabolic surgery only. That is all that they do, right? 1 year they can go up to 700 to 800 cases. So what they did is every patient, they have BIA, right? So this is in Chinese, but I translated for you. So this, the first one is a water mass. Then you have the protein mass, you have a bone mass, you have a fat mass. So this is what we need to see. We need to identify rather than the BMI. Yes, BMI is, I would say BMI is a screening tool for you to uh to to ascertain if the patient needs a bariatric or metabolic surgery or not. But you have to go in depth with the BIA, which is the most important thing is the protein mass and the fat mass. So when you go down further, you will see the muscle mass distribution. The muscle mass distribution, if everything I did of this patient, particular patient, the muscle mass distribution is quite good, right? This is the right upper lip, left lower lip, left lower upper lip, and this is the torso, and this is the right lower lip, this is the right lower lip, left lower lip. So there are some instances where usually the lower body is inadequate. So this is pertinent into the muscle mass. And the total body water, total body water should be around 30 to around 45%. So this one, he is actually quite good, right? And the best is you can, with the BI machine, you can have a trend of parameters where this is the total weight. The patient is from 74.3 kg, and this is over the course of 4 months, like 3 months, the course of 3 months. So then he has already reduced to 73.2. And the most important thing is SMM is a skeletal muscle mass. The skeletal muscle is not being reduced. If you look at from his weight loss journey, all right, he lost a few muscle mass here, but he eventually picked up. He very picked up, right? So, and this peripheral body fat, and the most important is the body fat. The body fat from 31% to 30%. This is actually very good. It's quite good already. And the water is actually, we just want to look at the water. Sometimes the problem in Malaysian also, Malaysian, we don't take water. We like to take bandung. I silap bandung. Or we like to take our favorite Milo dinosaur. Oh my God. Okay, that one is the worst. All right. So no, right. You must take more water. Right. If you take more sugar, you convert to fat. So your fat mass will decrease. Right. So, and when we are talking about metabolic surgery, we are talking about metabolic syndrome. And the most important component in the metabolic syndrome is actually type 2 diabetes mellitus. In a lot of papers have already told us that metabolic surgery is good to reduce the it can be reversed actually with a metabolic surgery, right? And this is from the insert of this, the guideline. And one, I wonder if you guys know what I'm seeing. And this is the overall diabetes, all right? But one thing is, this is a survey. This is a survey that has been done nationwide, all right? And those with diagnosed and non-diabetes, right? Already diagnosed and non-diabetes, and they took their fasting blood sugar and they diagnosed again to become diabetes is 11%. But the most important is this, the population with no symptoms, apparently no symptoms, raise plasma glucose of more than 7. This is actually diabetes, right? And they are not known to have diabetes, but if you look at these two arms, these are the patients maybe already on treatment, right? Already been sought, what is this, have already been sought treatment and follow up from the doctors. But the problem is this arm, these patients are the one that is concerning. Why? Because they never know apparently have no symptoms. Later I'll tell you what are the symptoms. Right? I think you guys must know what are the symptoms as well. And usually they have symptoms, but they don't know they have symptoms. That is the problem. Right? So you see both arms are the same. 11%, this is around 11%, all right? 8%, and this is like around 7%, right? 8.5%, 18%, and this is 13%, 5%, and this is 6%. This is even worse, right? Because remember, these are the patient that doesn't have any uh treatment attention, right? So in others also, others are like this is not Buniputra. Others are like foreigners, all right, okay, which are not in the survey, right? So, but this is more, right? So this is actually very concerning. And as a students, as a doctors, I think every doctors, even though you are surgeon as well, I don't care you are surgeon or you are in administrative later on, you should actually know the most fundamental factors, which is the type 2 diabetes mellitus. And the symptoms of type 2 diabetes mellitus are actually quite vague. Fatigue, lethargy, right? Polyuria, yeah, this is the triad, polyuria, nocturia, and polydipsia, right? Polyuria means a lot of urine, right? Nocturia means they pass urine at night, usually 2 to 3 times. And polydipsia, they always say they are thirsty, right? Polyphagia, they like to eat, they hunger, they are always feel hungry. And weight loss, if you have a weight loss, it doesn't mean that you are very good, all right? And this is without treatment. If with treatment, is different story. This is without treatment, with weight loss, it means that their diabetes is not well controlled. That's why they have weight loss. After the weight loss, then they increase, right? And pruritus bovale and balanitis, the genitalia will start have itchiness and all. So you must have these symptoms, all right? Actually, one symptom is enough. And you plus another, yeah, you have three. There are so many criteria for you to diagnose, right? There's a venous plasma glucose. You have a OGTT test. You can also use a HbA1c. My personal favorite is actually HbA1c. And mind you, venous plasma glucose is not the we call dipstick, right? The capillary blood glucose. That is not accurate. You must take from the vein. All right. So how to remember this? 7-Eleven. All right. I'm not promoting 7-Eleven lah. It's just let you guys do. All right. To remember better. All right. And because we are doing metabolic surgery, right? So we must understand what is metabolic syndrome, right? Metabolic syndrome is according to IDF, which is the International Diabetes Foundation. This is 2006. I think this is the latest definition. You must have a central obesity. So what is essential obesity? It means that the waist circumference, right, for male is 40 inch. Okay. So for female is 35, right? So female slimmer, right? Usually female are slimmer lah. And one thing is you must plus any of the two of the following of four, 2 out of 4, which is the TG level. You can have your HDL level, HDL cholesterol level, and also the blood pressure, right? This is you either or systolic or diastolic, right? Or you already been treated as a hypertension, and also fasting plasma glucose, or we call it FBS, fasting blood glucose, blood sugar, right? So this 100 milligram per deciliter is a 5.6 millimole per liter in what we use in Malaysia, right? So if the patient have you always say sangkau, right? Sorry, in Chinese, right? In Malaysia, in Malay, always tiga tinggi, right? But ada tiga tinggi. What are the tiga tinggi? High blood pressure, high blood glucose, high cholesterol. So this is actually the metabolic syndrome, right? There is one caveat here, very, very important. The central obesity is if the BMI is more than 30, right, you are already considered as a central obesity. All right. That means all the patients that come for MBS are actually metabolic syndrome if they have diabetes and hypertension. That's it. Right. So this is actually quite discerning. Okay. So before I move on, and let me see the chat box. What Lin issue asks, what is considered an acceptable amount of body fat? All right. For male, Asian male, for Asian male, age 40 and below. All right. Why 40? Because after 40 is a bit of different story already. Yeah. Okay. You guys are all students here, right? So 40 and below, I will consider for female will be around 20. If 20% of body fat, you will look like a model already. All right. For male, is 25. Right. So that I hope that will answer your question. But you don't want to go too less. It's like I want zero body fat. No lah, you cannot achieve that lah. All right. Maybe I want to achieve 10%, but I tell you 10%, you look cacasic. You don't look very nice. So I would say maybe for female, 15 to 20% body fat will be acceptable, will be the best. Right. For male, for female is 20 to 25. For male is 15 to 20. Why? Because female have more body fat. All right. And then you guys know where the body fat goes to lah.
If you found this video helpful, please like, share, and subscribe. Join the movement to eliminate obesity and reverse metabolic syndrome. Together, we can make a difference. Hit the notification bell so you will never miss an update. Follow us on social media for more tips and support.